Hi, I'm Dr. Sutherland, here with your daily dose of information on the disease of excess weight. Yesterday we talked about the concept of a weight set point and looking at your current weight as a percentage of that weight set point. And today I wanted to talk a little bit about what determines your weight set point and so what you can do about it. So the biggest things that can affect weight set point are genetics and age. And of course we can't do anything about those, but acknowledging the strength of those in determining our weight set point is really helpful. But there are some things that we can do things about, so we want to take a closer look at those things especially. One of the big things that I see is medications, so prescription medications. There's a long list of medications that can be weight positive and set that weight point higher than it needs to be physiologically. Many times people don't even know that the medications that they're taking have the potential to increase their weight set point. And unfortunately, sometimes they're even taking them to treat complications of the excess weight. And unknowingly, it has exacerbated the problem. So, of course, don't make any changes to any medications without consulting with your physician. But what I usually do is use our electronic medical record or just take a good history and look at all the medications that have been prescribed and cross-reference that with a weight flow sheet. And you can see if there's a relationship between when a medication was started and when a weight increased. And sometimes when that medication is stopped, the weight doesn't just go back down by itself, but at least stopping that medication will allow the weight to come off with some purposeful intervention. On the other hand, sometimes we look at a weight flow sheet and a medication prescription history, and there's no correlation. And then we know that, hey, we don't need to worry about that. We don't need to disrupt this person's treatment because in this person, this medication has not caused weight gain. Some of these common medications are hormone medicines for contraception or blood pressure medications, medications for mood, and medications for pain. So I find those are some of the most common medications that can affect weight. And there's a big crossover between blood pressure and pain and mood and excess weight. So there's a high incidence where somebody with excess weight is taking a medicine in this class. So it at least deserves looking at because sometimes those medications can be substituted for an alternative that doesn't cause weight gain, and you can get the best of both worlds and then maybe even improve that excess weight and ideally need as little medication as possible. So if you're taking any prescription medications, that's something to talk about with your doctor. Another thing that can affect a weight set point is medical conditions. And so as part of our evaluation, we look for those. And again, sometimes people don't even know that they have these medical conditions. So some of those common things are obstructive sleep apnea, or a low testosterone, or PCOS, or insulin resistance. And so checking for those or the risk of those is important because those may need a specific treatment to break the cycle where the excess weight has caused this condition and then the condition is causing more weight gain, and a person can't break the cycle by just eating less and exercising more, which is what they're usually told when maybe there's something else going on. So if you are considering what your weight set point might be and maybe if there's anything affecting it, talk to your physician about your medications and maybe whether you could have any of these medical conditions. And we'll talk more about what you can do about a weight set point tomorrow. Thanks for watching.